Now, Nigeria's nationwide immunization drive against measles, rubella, and human papillomavirus (HPV) is being hailed as one of the most impactful health campaigns of the current administration. Professor Temiye Edamisan, a consultant pediatric hematologist and oncologist at the College of Medicine, Lagos University Teaching Hospital, Idi-Araba, told Trust TV that vaccinating children at a young age protects them from infectious diseases. He emphasized the importance of ensuring every young girl receives the HPV vaccine to prevent future cervical cancer. The report.
As of early 2026, global immunization efforts against MR and HPV are intensifying, especially across Africa, where immunity gap remains a major concern. However, vaccination coverage does not always reflect actual community protection. In parts of northern Nigeria, false claims that vaccine causes infertility in women have been cited as a major obstacle. In response, Nigeria launched one of Africa's largest integrated vaccination campaign in October 2025, targeting over 106 million children aged 9 months to 14 years. By late October, officials reported that more than 58.9 million children have received the Measles-Rubella vaccine. Speaking to Trust TV, Professor Temiye Edamisan explained that HPV is linked to the majority of cervical cancer in women later in life.
For measles vaccine has been on for a very long time. The rate of coverage has not been very good, and that's why we are still having measles outbreak in Nigeria. But the rate has decreased considerably because of the campaign against measles. So to some extent, to a large extent, the campaign is working. But we are praying that Nigeria has 90% take-up rate. So if we're able to immunize up to 90% of those who are supposed to be immunized, we'll be able to control measles infection in Nigeria.
Residents of Lagos also share their views on the government immunization campaign.
It's a good protect from the government, and it's an awareness that people must be able to immunize all their children from age 1 to let's say 18. And like my own children, they have done that when they were still in childhood.
We encourage society that they should accept the fact that government is putting effort to immunize their children against this disease. That if they are not immunized against, can cause problems for them. So I encourage society to embrace it with love, and they should not frustrate the effort of the government, rather embrace it, and they should allow their children, mothers should allow their children to be immunized against the Human Papillomavirus and all other immunizations available for them.
There are some vaccines in which they give Africans, because I don't want to go further, because it should not actually affect like things around, like for me, anything coming from World Health Organization is a bullshit.
Since May 2023, Nigeria have recorded significant progress in HPV vaccination, with over 13 million girls already vaccinated. Professor Edamisan also debunked rumors that the MR vaccine causes brain damage or stunts child development. He called on the federal government to make the HPV vaccine available for teenage boys as well.
There is no evidence that vaccine leads to brain damage or cause a child not to develop properly. There is none. In fact, when you prevent such disease as measles, which when a child has it, the child may become malnourished, and even after recovery may suffer from another disease that can lead to death. When the child is immunized, such events will not occur.
He stressed that vaccinating all children against infectious disease is crucial for protecting communities and preventing outbreak.